really sense the mood of the people. Everyone wants a vaccine. Everyone is having a hope in that, and that hope is so huge that there could be a mad scramble, and that's why prioritization is. So vaccine, in a way, I should say the word rationing, but proper planning for usage of vaccine has been done by the government and by the expert group. However, there is a possibility that many people can do by smuggling or by other methods and get the vaccine. But the people must understand that it is a national fight. It's a global village which is fighting. People have to understand it. No amount of law, no amount of warnings will make people understand. Yes, you are staying at home, but the frontline worker, the doctor, the nurse, the technician, the policeman, the driver, conductor, they are fighting it. So please allow them to be protected first, and that's our duty. Secondly, people have to thank them for what they have done for last 10 months or so. So don't allow them not to get it, because if you get it with the limited supply, they may not be able to get it. Therefore, please, genuinely I request that people should understand this. Thirdly, people who have got the corona earlier, they might have the antibodies. I am not saying their antibody levels are high, but if, let's say, Delhi had a survey, Pune had a survey, Bombay, that 20% of the people already have antibodies. I am not saying that those who have antibodies or had prior exposure to COVID should not get it. There is very limited data. Their antibodies may not be enough, but they can wait. So I would say, let those who are on there, let there not be a scramble, let there be a proper understanding. And India showed it very well to keep distance. There was very clear message. So I would say that
Dr.
the
Narendra
people's
Gupta,
movement and
there are people who say that in the way the vaccine has spread through states like Bihar, which even after the elections, after mass violation of all COVID protocols, didn't see a massive surge in the number of deaths or cases. That's probably because the vaccine is already spread in the community, as it were. Even if we haven't reached the herd immunity level, it's spread far and wide in the community, and therefore by the time your turn comes for the vaccine a few months later, maybe we've already achieved herd immunity as a city, as a state, as a country, and we won't need the vaccine at all. How do you respond to naysayers who are saying these kind of things? Well, what's your sense? Is that even fair? Is that even a correct way of thinking, Dr. Gupta?
I think that kind of a situation already has come to a certain extent, and there are enough evidences for it. You see that many of these events have happened in spite of that, and the weather had become a very extreme, in the sense like the winter has set in. In spite of that, the numbers are continuously declining. The number of people who are getting infected and the number of people who are dying are continuously declining. As I was doing a simple calculation today, it says that there are 3,63,749 people who are currently active cases in this. If we take 5% of it as a critical, then the number comes to about 18,187 for the entire country of 1.35 billion. If for the country of 1.35 billion, there are only 18,187 people who are critically ill, and that too are limited into big towns like Delhi, Bombay, Chennai, Ahmedabad, or so on. This is a very small number. Means we have to first, to go for the vaccination, we have to find a reason that we really need a vaccination or not. Because the current indication, of course, one of the thing is that I also wanted to bring in this issue of COVAX, that this Gavi, WHO, and they all said that they'll be doing the pooled procurement and then there'll be equitable distribution of vaccines. Nothing of that sort is visible. Countries who could afford to buy vaccines, they already have pre-booked vaccine to the extent that 5% more, 5 times more than what is required for their entire population. That is the kind of a situation. There is a bad rush. But I am not worried because they have very high level of mortality and high level of morbidity.
Okay, Dr. Madad, I'll let you respond to that concern. That by the time your turn comes for actually having the vaccine, maybe you don't need the vaccine at all because the virus is already spreading so fast in the community. Dr. Syra Madad.
I think this is going to the mentality of letting the virus spread and getting it naturally. and basically walking over gravestones. And I don't think that's obviously a great approach for many different reasons. We want to make sure that people get vaccinated once the vaccine is available, because the entire goal is to reduce morbidity and mortality in individuals from getting infected and from hospitalizations and dying from it. If you're looking at the data around the world today, you have thousands of new cases coming. And so I think it's really important for people to understand that when you look at the virus and you see that, certainly a number of people, a number of people will have a good outcome, but you're seeing long COVID symptoms persist for a certain period of time. We don't know the overall sequelae of this disease. You're seeing more and more information come out in terms of people having mild cases, but then down the line they have increased risk of cardiovascular disease, lung disease, renal disease. And so really, really important for people to understand that when a vaccine is made available, this is something that's going to help prevent from those types of occurrences. And so certainly, natural infection is something that's going to continue to happen. It's happening. We have a raging pandemic all over the United States, all over the world. And so we want to make sure that people understand that when a vaccine is made available, that you do get vaccinated to prevent these severe outcomes from actually happening.
I'm going to leave it over there.